State officials telling Fox 61 tonight they are confident they will continue to receive the second doses of the COVID-19 vaccine on time, but they do need to see an increased supply of the initial doses in order to meet demand as Phase 1B gets underway. Phase 1B officially kicking off Monday. Those ages 75 and older first in line to receive their new COVID-19 vaccines at the new mass vaccination site at the former Pratt & Whitney runway in East Hartford.
It went very well.
State officials say although they are receiving between 40,000 to 80,000 COVID vaccine doses per week, it's not enough to keep up with demand.
We do need the numbers to increase. We're going to have more capacity to vaccinate people than we're getting vaccine coming in from the federal government.
Although state officials say the federal government has done a good job shipping out the correct number of corresponding second COVID-19 doses. With clinics around the state, including Norwich, Torrington, and Hartford's Convention Center, Hartford Healthcare says it lines up patients' second dose appointments to when they received their first dose, ensuring they receive the final vaccine within the recommended 21 to 28 days.
We received 100% of our dose 2 orders for the first 4 weeks that we've had availability. The process has been seamless with the Department of Public Health. They know how many doses were ordered for dose 1 for the 2 different vaccines in the right week to order the dose 2 supply. So it's been going really well, and it's all built into our clinic schedules to have those dose 2 appointments available.
But what happens if you do not receive the second dose within that time frame?
Really what happens is if there's a delay in dose 2 being administered, it just delays getting to that 94 to 95% effectiveness rate.
State and health officials also say they're working together to ensure vaccine doses do not go to waste, which Hartford Healthcare says could happen if the vaccine reaches its refrigerated expiration date, or if someone cancels their appointment last minute, or if there are partial vials left over at the end of the day.
Every clinic that's running, we give them very specific instructions to have a waiting list of people who are also eligible in that phase, so that if you get cancellations during the day or if you end up with a few extra doses at the end of the day, you can call other people in to take those doses. We don't want anything going in the trash. We want every dose going into an arm here in Connecticut.
And Hartford Healthcare says as Phase 1B gets underway, they're now aiming to vaccinate up to 2,500 people per day. In Hartford, Nia Maldonado, Fox 61 News.